Hi everyone, it's Sarah from International Rejuvenation, and today I'm just going to talk about paying for your plastic surgery in Thailand. A question we often get asked is, when do I pay for my surgery and how do I pay? It's a question that everyone wants to know, and we answer constantly for people, so we're just going to cover those today. So the first thing is, you don't pay us for your surgery. People often think that they'll pay us. You don't, you pay the hospital directly. And I'm just going to go through the payment options, surgery cost, and when to pay for your surgery. So first of all, different payment options. You can pay in Thai baht, Aussie dollar, credit card, bank transfer, or travel card. First of all, I think the best way to pay, me personally, is Thai baht. This way you incur no fees at all, and the best way to do it is take your Aussie dollar over with you and transfer your money over to Thai baht when you're there. That way you get a much better exchange rate than if you change your Thai baht in Australia. Of course, then the other option is paying Aussie dollar. You will incur a slight fee from the hospital, so to me it isn't as good, and if you've got the cash you might as well exchange it over when you're there. Not everyone, of course, feels comfortable in taking that large amount of cash with them, so therefore the next option is credit card. So if you don't like carrying your cash, you can pay by card. Always make sure that you ask your bank what kind of fees you will get charged, because you will incur some fees, and sometimes they're a little bit cagey on letting you know what kind of fees, but you always incur an international transaction fee, and then on top of that they'll normally charge you a percentage. So really make sure you know what your fees are going to be if you pay by credit card. And of course the other thing you have to do is make sure your bank knows that you're going overseas to have surgery, therefore you'll be taking out a large amount of money. So when they see you try and take a large amount out, they don't shut down your card. That'd be the worst possible thing to happen. So always make sure you know what kind of fees you will incur with your bank when you're paying by credit card, and let them know the dates you'll be traveling and that you will be taking a large amount out. Okay, the next one is bank transfer. If you'd like to pay by bank transfer, just let your case manager know and she'll send you an email with the account details of the hospital, and there you'll be able to pay directly to the hospital's bank. Of course, if you do choose this option, it can be a little bit stressful because sometimes it can take a couple days to get notification, and other times it can take all the way up to a month. So if you do this, it's hard for us to assist you because it's straight from your bank to their bank, and we're just kind of like the middleman that can't do much in that instance. So it's a great option if you want to pay before you go. Of course, if you do pay by bank transfer, you may have to pay a slight bit of difference when you're there due to exchange rate, things like that. So you may have to pay a little bit when you're at the hospital. The next one, of course, is travel card. I personally think this is the worst way of paying. I cannot tell you how many patients of ours over the years have tried to pay by travel card, and it's so hard and frustrating for them at the time. Your travel card often says that you incur no fees, which is incorrect, and they also say that, yeah, you can take that money out, no problem. However, when you go to take the money out, they often you often incur fees, so the amount you're trying to take out, they won't allow you to take out because it's too much. And of course the daily limit, even though you've asked them, sometimes it is much less than what you've actually been told. Therefore you have to call your travel card person back in Australia or New Zealand and discuss what's happening, and it's just really stressful and it causes anxiety, and the last thing you want before your surgery is travel card and money issues. Like, it's just stressful. Nobody wants that. Okay, so the next thing I'm going to cover is cost of surgery. You find out a cost estimate for surgery as we go through the process. It normally comes with your evaluation. Of course, it's just an estimate. Some patients think, I'm going to be a little bit cheeky and I'm going to try and barter at time of consult with my surgeon. you can't do this. This is an international hospital and the surgeons are highly skilled plastic and reconstructive surgeons. They're not going to drop your price just because you want to be a little bit cheeky. Okay, so no bartering, people, don't bother trying. So the next thing I'm going to go through is when can you pay. Of course, as I've touched on earlier, if you bank transfer, most of it will be paid, but there's normally a small amount, and you can either pay this after your time of consultation or at time of discharge. And for all the other payments, exactly the same thing. You can either do this after you've had your consult with your surgeon, or the other option is at time of discharge, you can also pay them. So that's all I wanted to talk about today. If you have any questions, please call us on 1300 140 040. Email us inquiries at internationalrejuvenation.com.au, or of course for heaps more information just head to our Facebook page, International Rejuvenation. Okay, thanks for watching. Bye.